So we're going to be talking about pandas, which is not the animal. It's pediatric because it's a childhood onset disorder, usually prepubertal. Pediatric, it's autoimmune, and it's neuropsych. It's a disorder, and it's associated with streptococcus, strep. And that means strep throat and impetigo. There's a group A beta hemolytic streptococcus. Some sort of molecular mimicry occurs, and then you get an attack on some part of your body, an autoimmune attack. And you're probably familiar with the other post-streptococcal conditions, post-streptococcal glomerulonephritis, post-streptococcal movement disorder, which is called the Sydenham's chorea, the St. Vitus dance. You could have post-streptococcal polyarteritis nodosa looking thing. You can have post-streptococcal neuropsych manifestation, including acute onset of OCD. So when we have an acute OCD after strep, you should be thinking about pandas. It comes to ophthalmologists as tic. So a tic. So that's the compulsion part. So having a tic is a compulsion. Having an obsession is thinking about it too much. Intrusive thoughts that sometimes are made better by the tic. So that is the O, the C, and the D. You have obsessing. You relieve some of that obsession with a compulsion, in this case, looking up or blinking your eyes or whatever your ocular tic is, and it's a disorder. And acute abrupt onset after streptococcus is what is making the defining characteristic of pandas. And it's similar to these other post-streptococcal disorders, including rheumatic fever and cardiac disease, but it looks like neuropsych. And sometimes psych is from neuro, and sometimes that neuropsych is from autoimmune. And if it occurs in a kid, prepubertal pediatric after strep, we call that pandas. So before you call this tic a DSM-5 OCD, you must make sure that it's not pandas, because the treatment, treat all the strep, antibiotics, and then controversial about Western pharmacologic immunosuppressive treatments, continued prophylactic antibiotic, controversial, and non-Western, non-pharmacologic countermeasures all have been tried, but really no good treatment. You need to know about pandas.